Thank you so much. So welcome to everyone who is joining in for the first time. Welcome back to lots of familiar faces here. This is our stretch and strength for spine health class using the foam roller. So we will use the roller. We will also use our yoga mat space if you're just getting set up. For those of you who are new to my program, my name is Allie. I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing here in Boston over the last 5 years and teaching with the Community Online Academy every Thursday since March when the program started. So in today's program, we're going to do lots of movement. We've got 30 minutes. We'll do some stretching, some strengthening. We're going to focus in on the legs today and try and get both the front and back side of the legs with our rolling. So the one thing I'll say before we start with our movement is that everyone's bodies are a little bit different, especially in this class. There's a lot of opportunity to customize the program to your body by kind of listening to my cues, maybe spending a little bit more attention where your body feels like it needs it, which is different than mine and different than your friends and your neighbors' bodies. So please listen to your own body as you move through class today. And if you need to take a modification, you can certainly do so and join back in when you feel comfortable. So we're going to start today with the rollers on our mat. Let me just adjust a little bit there. Okay. All right. And we'll find a position where the roller is underneath our knees to begin. So kind of just resting under, I call it the knee pit. And then you're going to lie down onto your back. So it's just going to provide a little bit of light support here. So you can let your head rest down, arms rest down by your side. The roller just acting like a little pillow underneath your knees, and just roll around and adjust till you find a comfortable position. And we'll just take this first moment in class to let your body relax on the mat, getting connected to how you feel right now in this moment. So we'll take a little body scan from the very top of your head down to the tips of your toes, just noticing how your body feels and perhaps any spots of tension in your body. Feel the heaviness of your hips and the weight of your knees on that roller. This position can be nice in that it takes off some of the pressure from your low back by providing just a little bit of support for your legs. And as you lie here, we'll tune our attention into your breath. So start to take those big, deep inhale breaths in through your nose, filling up your trunk cavity like a balloon, and gentle exhale breath out, letting go of that air that spends its time deep in your lungs. Take a deep inhale breath in through the nose and an exhale breath out through the mouth. We'll try once more here, a big inhale breath in through the nose and an exhale breath out through the mouth. And we're going to warm up with a little bit of core work here. So this position is something I show you guys, one, as a little tool to help relieve some back pain if you are having pressure with laying with your legs totally flat. It's also a nice tool to give us feedback about how to keep our trunk still during ab work. So what we're going to do is very carefully start to keeping your pelvis level. So imagine like there's a glass of water resting right on top of your belly. You're going to pick one leg up to tabletop, place it back down, the other leg lifts, and place it back down over the roller. So nothing fancy here to start. Imagine that that glass of water is super, super full, and you're trying to keep that water from spilling even a drop as you lift your legs. What can be helpful is to press the opposite leg down into your roller as though you're trying to keep that roller still. So it should feel lightly like your core is doing a little bit of work to help lift that leg off the roller. Now you have the option to stay here. Otherwise, we're going to place the ball of both feet, so kind of that space between your toes and the ball of your foot, on the top of the roller. And we're going to roll the roller out as far as you can go, keeping the stomach steady, and pull the roller back in. Roll the roller out, it'll go onto your calves, and pull it back in. Now, it can be tricky to really roll the roller with your feet like this. You may even get a cramp in your foot. I want you to think of pushing your legs down, which should help activate the muscles on the back side of your body. Now, if this is feeling really easy for you still, You can curl your head, neck, and shoulders up almost like you're doing a crunch and just watch your trunk. That glass of water is still there and it's still steady. So there's no rocking back and forth of your pelvis. You stay nice and still. 3 more. Good. 2. Pull back in. 1 more time there. Pull all the way in. And then as a little challenge, if you would like, stretch that roller out long. Reach your arms long overhead. This is totally optional. We're going to try to roll up to sitting with your legs elevated, which is not easy. I throw that little challenge in there just to give you guys something to work on. We're going to spin that roller around so that we line it up behind our backs, just below our shoulder blades. So I find the easiest way to do so is planting both feet down on the mat. I'm going to hold the roller with my hands as I lean back. Find the roller right underneath my shoulder blades, and then hold my head with both hands. And you can get your hair out of the way if you have longer hair. If you have a hood on, you'll want to remove that as well. So in this setup, what we're going to do is start to roll from the bottom of your ribs to the top of your ribs. And that's basically the base of your neck to just below your shoulder blades. So pick your bottom up, and we're going to start to roll back and forth. This rolling here is for your upper back, your thoracic spine. And our thoracic spine is important in managing both neck and lower back pain. It's right between those 2 points. It's also an area where many of us have stiffness. So as you roll back and forth here, if you hear cracking or popping or it feels super tight, that's normal. And just know that if you need to take a break, you can always place your bottom down. But I think that you will feel a little bit better after practicing some of this stuff a couple of times. So nice and gentle. We're using this forward and backward rolling, 1, to loosen the muscles around your spine, but 2, to help assess where those spots of tightness are. And that's going to be different from person to person. So the next time you find one particular spot that's a little bit tighter than the others, pause there. Place your bottom down, draw your ribs down towards your hips, and let your spine drape over the shape of the roller. So I want you to think not even so much of dropping your neck back, but actually letting your upper back create that kind of arcing shape to mimic the foam roller. We take a deep breath in through our nose, and that same exhale breath out through the mouth. Try 1 more breath here. Our rib cage attaches to our upper back so we can get a better stretch here with that deep breath. From here, we pick up and we continue to roll. So we'll go back, making sure that you roll all the way up to the base of your neck and all the way down to just below your shoulder blades. We are not rolling on the low back in this setup. We're focusing here on the upper back. Now, as you're rolling, there's a few dimensions we can add in. The first of which is the side bend. So if I sit up, I will show you guys here. You can keep rolling. Side bend is bending sideways so that your elbow comes closer towards your hip on that same side. We can also rotate, which is turning one elbow up, one elbow down. So we'll do that on the roller. As you go back and forth, you guys can try that here. We'll start with side bending first. So you're going to tip your right elbow towards your right hip to open the left side body as you roll. You can do the same thing going over to the left, rolling out your right side. And different people are going to be tight in different areas. I know for me today, feels like my left side is a little bit tighter. So I'm going to spend an extra moment or 2 there, rolling back and forth, just letting my body breathe at a comfortable pace. You can also try that rotation. So tipping one elbow up to the ceiling and the other elbow down towards the floor. In that rotation position, you're going to get more into your lat, which is a shoulder muscle. We're going to use that muscle in a little bit during this class. Good. You can try same thing on the other side, noticing how that feels. And while the lat is a shoulder muscle, it does actually attach all the way down to your low back. And so it can influence how tension and tightness in that area feels. Good. You can come back to the center. You can also pause and try some of that dropping over the shape of the roller. So this type of rolling is really oriented more towards our joints than the muscles itself. And so for that reason, you could do this rolling for your upper back a couple times during the day, especially if it feels good. It can be very helpful for those of you who have to spend most of your day sitting kind of bent forward. Good. We'll try just another moment here. And last time. Good. And then come all the way on up to a seated position. Take a moment, you can roll out your shoulders, take one of those deep breaths in. I hope now that it feels maybe a little bit easier to take that deep breath now that our rib cage has just been mobilized by the roller. So while we have this set up, we're gonna do a little bit more core work that looks like that first exercise we tried in class today. So same thing, you're gonna line up the roller right underneath your shoulder blades, holding your head in your hands, knees bent, feet flat. Draw the space between your ribs and hips closer towards one another, and then imagine using your ribs to push down into the roller. So you're thinking the front ribs pressing down to hold pressure on the roller. Like if I were to come around and try and take that roller away from you, I wouldn't be able to. It's being held in place. Now, just like we started class, we're going to do those marches. So this time you can see your trunk and imagine that that glass of water is still resting right above your navel. As you hold that glass of water steady, continue with your little marches here. You also want to feel underneath your rib cage that the pressure on the roller stays the same the whole time. So keep pressing the back ribs into the roller. Now, just like we did earlier, if this is feeling easy, you can lift both legs up to tabletop hold. Try pressing both legs out and both legs in. Modification is to push up a little higher. Challenge is reaching down and out a little bit lower. Imagine like you're rolling your feet along that roller as we practiced before. You can also try single leg here as another option for a modification if that double leg feels like too much. And you will know because you will lose that pressure of your rib cage on the roller back behind you. 4 more. 3, 2, last time there, place both feet down. You can drape your spine over that roller one more time, taking a deep breath in, letting your head hang heavy in your hands, and then a deep breath out, and then come all the way on up. Awesome, guys. So we're going to take that now into a little bit of work for our lats. So we talked about our lat muscles, the shoulder muscle. It attaches all the way down towards our low back. So we're going to flip to our stomach, keeping that roller right in front of us. If you know that you have some shoulder sensitivity or this is a new, I'm going to just adjust a little bit so you guys have a better view here. Okay. So any shoulder sensitivity, or this is a newer exercise for you, you're going to practice with your elbows bent slightly to start, palms resting on top of the roller. If you are more advanced in your practice or you want to try a challenge today, straighten your elbows, press your hands down into the roller, feet are glued to the floor, and head is long, hovering just above your shoulders. Start by pressing down into the roller. Pull the roller closer towards you, dropping the elbows away from the ears, and press down into the roller to lift up and slowly melt and lower your spine back down. With bent elbows, same thing. We're pushing down into the hands, keeping the neck long and rolling gently back down. Now that pressure of the hands down into the roller is really important. I want you guys to think of that rolling we did with our feet earlier, how we were pressing into our feet to pull the roller towards us. We're going to do that same thing here, working our spine into extension. And this extension position is the opposite of how we spend our time sitting, which is bent forward in flexion. Press down into that roller, lift the head tall, and gently roll, melting back down. You can work with those straight arms. We'll try 3 more here. And soften, melting back down onto the mat. Head long, shoulders down for 2. And gently lower back down. 1 more time here. Come all the way up, up, up. And softly, gently lower back down. And we'll lift ourselves all the way on up and take a moment's pause. Awesome. Now we're gonna build in a little bit more strength in this setup before we get into some of the foam rolling for our legs. So for this one, you're gonna turn your roller sideways so it is along the length of the mat. Keep it on the right side of your mat. So I know my roller is long, yours may be shorter. That is totally fine. We're gonna place our right hand on top and our left hand down onto the floor, setting up in an all fours position. And I know it's a little bit asymmetrical. You're having your hand elevated on that right side. Now, hands should roughly be underneath your shoulders, knees roughly underneath your hips. Without changing the position of your spine, reach your left leg back behind you. Just hold your balance. Keep your neck long, draw your ribs up away from the floor, and we're gonna do a little push up here. But before we move our arms, I want you to straighten that left leg really long. Think of it like a scorpion tail that's gonna lift up and push you forward and come back up. Try again, we lift through that left leg, lower down, push back up. Try and keep that roller still by pushing down firmly into that right hand. We have 4 more. Lift. Last 3. Come up and lift. Good, guys. Last 2. Up and lift. One more time here. Lower. Come up and lift. Drop that left knee down. We're going to roll the roller to the other side of the mat and try the opposite setup. So left hand is on top of the roller. Right hand is on the floor. Unlock your right elbow. We're going to slowly extend the right leg long back behind you. Stretch it long and straight. Keep your right elbow unlocked. Use that right leg like a scorpion tail to come into your push-up. So what this looks at is the balance between our shoulders and our hips. And I know we say, wait a minute, this is a spine class, but the balance between our shoulders and our hips is what either moves or doesn't move our spine. So if we feel imbalanced on one side compared to the other, just something to notice and maybe spend a little bit more time working on that side. Once more here, and then come all the way on up, drop it down and take a little rest. We'll shake it out. Nice work there, guys. So we're gonna now get into some rolling for the muscles on the back side of our legs. I'll adjust the camera a bit here again so you guys have a better view. We're gonna sit down right on top of the roller to get into our glutes. Your glutes being your butt muscles, the back of your hips. So we'll do one side and then the other. I'm gonna start with my left side so you guys can see. I'll bring my left hand down to the floor and I'm gonna turn and rotate my body slightly towards the left. From there, I'm gonna start to roll back and forth over the muscle. So the muscle in the area along your glutes goes from the very back of your pelvis down to what I call your sit bone, so that bony part of your bottom that you might sit on top of. You can be rolled a little bit more to the side to get into those side hip muscles, or you can stay facing up towards the ceiling. So it depends where your body feels the most tight, which is different for everyone. And our glutes are actually made up of a bunch of small muscles. So different muscles on different people are going to be tighter. So you can spend more time where you feel like you need it. If you think you need more pressure here down into the roller, you can cross your right ankle on top of your left thigh. That's going to put more body weight down into that left side. Make sure that your shoulder is down away from your ear and there is a big bone on the side of your hip. You want to be cautious about rolling right over that bone. That's because there is a bursa underneath. A bursa is a fat pad that is there to protect against friction. It does not like to be rolled over, and you will know because it's very, very uncomfortable, and it doesn't usually feel better afterward. So while rolling on the muscle can be uncomfortable, it is something that usually feels better after we stop. So we'll take another moment here on this left side and then flip on over to the right. Good. So we'll go ahead now, push your right foot down onto the floor, rotate and place your right hand behind you, turn to face towards the right and start to roll. And we'll start with both feet down. You can notice if your body needs more weight on this side and add the cross of your left leg, but just start and assess with both feet down on the floor. And I like to use my feet as the driver here to push forward and backwards rather than pushing with my hand. So for some people who have sensitive wrists, if you're pushing with your hand, that can be a lot of pressure. My hand is there kind of just for balance, but I'm really pushing with my legs back and forth to create this movement. Again, you can add that extra body weight crossing over if you need. You can get more into the side hip muscles or kind of stay centered, getting more into the central glute muscles, which are the ones that help to move your leg back behind you. So if you can imagine when you're sprinting and your legs are kind of pushing off back behind you, that comes from your glute muscles. The ones on the side of the hips are what keep you moving forward instead of wiggling side to side. Good. We'll do just another moment here. Excellent. And then we're going to take that roller out from underneath our bottoms, but stay seated so that the roller is underneath your thighs now. So the meaty part of your hamstring goes from your knee right up to your hip. So we're going to roll on the hamstrings next. And we'll use the body weight up on the hands, but I'll give you a modification in a moment if it feels like too much pressure. So my fingertips point out to the side. I'll make sure that you guys have a better view here, just in case on this one. My fingertips point out to the side about 6 to 8 inches behind my bottom. So from there, I'm gonna open up my chest, keep good shoulder posture, rolling right up to the bottom of my hips, right down to just above the knee. We're not gonna roll over the knee joint, mostly because it is just tendon at that point. It's not actually the muscle belly. And we have a lot of joints and ligaments in that area that will feel pretty uncomfortable to roll over. So we wanna stay on just the muscle itself. And as we roll back and forth over the hamstring, you may find one leg is tighter than the other, in which case you can give more pressure by crossing one ankle on top of the other and continuing to roll back and forth over that area. You can do the same thing on the other side, cross one thigh on top so that it puts more body weight down into the side that's on the bottom. Now, some people might be tighter down low towards the knee. Other people might be tighter up high towards the hip. If your wrists really are getting quite tired and sensitive, you can roll on your forearms. Just know that it's a lot of work for your shoulders still, and it is a bit of core work to hold your hips up in this position. So that's something you can try here if you would like. I think it can be a little bit more effective to be up on the hands. Good. Now our hamstrings are made up of 3 muscles. They lie one next to another. So you can roll your legs a little bit to the outside and a little bit to the inside to notice the differences in those small little muscle fibers that make up the hamstring. Good. We'll try 2 more just like this. Awesome, guys. Once more there. And then place your bottom down and take a little rest. Now, we're gonna do a little bit of strengthening work for the hamstrings and the glutes now that we have loosened up that area and brought a little bit of extra blood flow in. That should help reinforce the new mobility that we just created for those muscles. If you'd like to try a little challenge, we're gonna roll back down onto the mat, get a little bit of core work in there, and then place the arches of both feet on top of your roller. So let the arches of your foot drape over the top of the roller, arms down by your side. Imagine a little pillow between your knees hugging in together. Think of pushing the roller down into the floor to hold the roller steady so that it doesn't move even an inch as we work through this series. Keep the back of the shoulders down. We're gonna lift the hips into a bridge, push the roller forward an inch, pull it back an inch, and drop the hips back down. When we lift the hips up, the roller is still, then we move it back an inch, forward an inch, and drop the hips down. As we lift the hips up, this is your glutes working here. As we move the roller, that's your hamstrings working, and drop back down. Now you have the option to take out that little extra roll and just practice that lift and lower here if you would like. We'll do 2 more of that full set. We lift up, roll out, roll in, drop the hips back down. Once more here, we lift up, we roll out, we roll in, drop the hips back down. We'll place the thighs back on that roller, and we'll try one more time with that roll up motion. So reaching the arms long overhead, take that inhale breath. As you exhale, lift to the toes, roll yourself up to sitting, keeping your legs on the roller if you can. And that roller should be underneath your calves now. So our calves are the last thing we're gonna roll for muscle group here. That'll go from the ankle around your Achilles tendon to the knee, but again, not over the knee joint. So hands are gonna reach back behind you, open up the collarbones. We'll lift our hips into a hover and roll that roller all the way back to your ankles and push it forward to the bottom of your knees. As you're rolling back and forth here, you can place your bottom down, readjust for your wrist position if you feel you need to. But I always like to imagine that I'm threading my bottom through my hands, which is also a really good core work here. Now, just like the hamstrings, you can cross one ankle on top of the other to put more body weight into the calf. On the other side, that would be one ankle on top of the other. And you can roll. The calf is a fairly broad muscle. You can roll to the outside or the inside of that muscle, just noticing where your body has more spots of tightness. Check in with your shoulders. Try and keep space across the collarbones, keeping your neck long as you roll. Even though we're working on the legs, we want to keep good upper body posture here as we work. And we're working on the calves because they are our shock absorbers for our back. So our calf muscle, when we're walking and running, they help to absorb the force and shock of our body hitting the ground before our back does, which is a good thing because we don't want to have lots of impactful forces going through our spine over the course of the day. Good. We'll spend just another moment here. And then we're gonna come all the way up to a standing position so we can use our calf muscles a little bit. So take your feet on off. We'll find ourselves up tall in a standing position. I'll adjust again here so you guys can see. And we're gonna do some calf raises, nothing fancy. You can, if you have a long roller, pick it up and use it for a little bit of balance next to you. You don't have to. Find your feet parallel underneath your hips. And again, your hips are not the widest part of your legs, but actually your femur bone comes right up into your pelvis. It's about in the middle of your thigh. That's where your hip joint is. So look down, find your feet firmly pressed into the floor, and we'll start to lift and lower. So we're going up and down, nice and gentle. Imagine like you're lifting and lowering from a sheet of glass, okay? It's there, but it's delicate. So we want to be gentle with our feet as we lift up and lower back down. That helps us to get that feeling of shock absorption, of slowly, which is eccentrically using the muscle. Eccentric means the muscle is getting longer even though it's working. And that's what helps us to slowly lower to the floor instead of plopping with a thud. Notice if your body is compensating by leaning backwards, if you're using momentum here. You want to try to stay stacked tall so your shoulders are over your hips, hips over your ankles. We lift and lower. 5 more. And 4. Nice, guys. Last 3. Last 2. One more time here. Drop the feet down, shake it out. We'll finish with a big community breath in together. So we're all standing. Find the tallest spine you've had. We'll take an inhale breath in, reaching up tall, and a big exhale breath out to let it go. Awesome job, everyone. So that is the movement-based part of our class. I know we're right at the end of our time here, but I'm happy to answer any questions that you have about the program we worked on today. I hope you guys learned a couple of techniques that are helpful to get into the backside of our legs. This is where many of us have tightness related to sitting, as well as some strengthening things that you can use your roller for to help reinforce that new mobility you've gotten from today's class. I also ask if you guys have a moment to stick around.